Hello.
Hey, good evening, guys.
Good evening.
Hello, good evening.
Good evening.
Hi, Cuckoo.
Meeting is streaming live on YouTube.
Wave if you can hear me.
It is streaming live on YouTube. So, hey, Bill, can you hear me now? Dr. Warner?
I can hear you.
I can also hear you.
Okay, great. Dr. Warner, I'm not sure, you might be the only one that can hear me. The most important person in the room, right?
Maybe he doesn't have his sound turned up. I'll send
Yeah.
him a chat.
Good idea. Okay, I just sent him a quick note.
Me too.
I think he might have exited and he's gonna come back, so.
Maybe he's trying to reboot.
Yeah. Technology, huh? Maybe we'll be back in person soon with all this, with COVID-19 restrictions kind of sort of ending at this point.
Do you guys know there's a channel on Comcast 24 hours a day with news from Israel?
Really? I didn't know that.
It's 1118. Yeah, it's interesting. They have all kinds of programs besides news.
Huh. Dr. Warner, you're back.
I'm back. I had to leave and come back. Apparently the sound problem is fixed now. So
Good, great.
Sorry.
Well, you can go ahead and start the meeting at any time you'd like, Dr. Warner.
Okay. I'll call the meeting to order for the Skokie Board of Health on June the 10th, 2021. And I'll start out by reading the statement that until further notice, meetings of the Board of Health will be held electronically with majority of the members participating via remote access in order to comply with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charlie with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to publiccomments@skokie.org, by mail to Village of Skokie, attention, Michael Charlie, Director of Health and Human Services, 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village Dropbox located by the public entry to the Village Hall. Mike, do you want to take attendance at this point?
Yeah, sure. So I have, hold on, let me open up I think I have everyone, I see everyone, but so I have Dr. Dave is here. Dr. Drackler, Dr. Drackler's here. Dr. Gaines, Miss Hato. I see Maureen Hanlon is here. I see Margaret Keeler is here. Is Miss Kumar here? Okay. Dr. Lin, I see is here on his iPhone. I have Heidi Nikish Dugan. Not here. I have Rohit Pandya. I see you. Okay, I got you here. Thank you. I have Miss Shim. Looks like she's absent. I have
I'm here.
Oh, I see you. There
Dr.
you are.
Shim, yeah.
Okay. And then I have Dr. Sood. I see you're here, and Patricia Urbanis is here. Urtaza Uzman,
Yes.
you're here? Okay,
Yeah, I can hear.
I got you. And then I see Ruth Varma's here, and Dr. Vernon is here, and Dr. Werner's here. Dr. Williams is not here. And then I see, I saw Sybil, I think, right? Yeah, I see you. Okay, great. We got a good crowd tonight. Thanks.
So we have an agenda, and we use a consent approach for both the agenda and the minutes. So unless there's any extractions, the agenda and the minutes will stand as published. Are there any extractions? Seeing none. Yes? Dr. Sood?
No, sir. Everything's good. Sorry.
Oh, okay. All right. Okay, with that then, I'll go right into my report. And I'll start out by asking Maureen or Ed to give us an update on the bicycle safety afternoon with the Skokie Police Department. I understand you had a good turnout.
Yes, it was very well organized. The police officers were very kind to Ed and I. They protected his bike. Ed's whole family came. There were lots of children, lots of adults. And he and I got an opportunity to tell children with their parents present the proper way to wear a bike helmet. And Ed even assisted a few kids to show their parents how to adjust the helmet so it protects their frontal lobe. The weather was good. We had a good time, and I got to know Ed better too, which was very, very nice.
Ed, do you have any comments?
I think that Maureen covered it beautifully. I have to say that it was a wonderful event, and I give the police department a lot of credit for organizing it so well.
Mm-hmm. Yeah, they had a course that the kids had to ride with yield signs and stop signs, and some of them did it like 12 times. They just kept doing it and doing it. So it was good. It was very, very productive and right on to teach the kids about bike safety, and their parents as well.
It was very nice to get to know the police officers, and maybe I'll become a police person when I grow up.
Not me.
All right. Well, thank you for doing that. And hopefully we'll see everybody wearing their bike helmets now when they're cycling around the village. Another thing to report, on May 20th, Director Charlie and I met with the village board and the mayor as part of a ongoing yearly presentation on the budget. And each of the boards and commissions meet individually. And we had a chance to brag about you folks and all the things we've been doing this last year despite the pandemic. So I thought it went quite well. Mike, I don't know if you have any observations about that meeting on the 20th.
Yeah, I mean, I thought it went really well. And I think that Dr. Warner gave a wonderful presentation to the village board regarding the Board of Health, and really said all sorts of nice things about you all. So I really appreciate Bill taking time out of his schedule to come in and spend time with the board. You know, it's always really helpful to have the chairs of the commissions come in and present to the board. I think they really appreciate it. And I think the board expressed their sincere appreciation for everything that you guys do as a board. So that's about it.
Yeah, they had some good questions, and I appreciated the chance to meet with the board and the mayor. Some unanswered things. The mayor wanted to know if we're going to need a booster shot, and I said, we don't know at this point, but it went well. A couple other things I want to highlight. This month's journal from the American Public Health Association it's actually devoted to COVID issues. And Mike, if you want to pull up that cover, so you don't have to look at my face while we're discussing these things. But there are a couple items I want to lift up because they apply to what we're doing here in Skokie. One is positive strategies for people that have questions or are hesitant about vaccinations. And I thought this was really well done. The title of one of the articles is First Do No Harm, which of course is our maxim in healthcare. Before we do an intervention, let's make sure it's going to be beneficial and not cause harm. And so the article talked about how to approach the folks that have questions or hesitant, and to take a question and answer approach. And if any of you have seen the eSkokie news the last 2 weeks or gone on the website, you see that's the approach that the village is taking. I think there were 10 questions that got answered in a straightforward, understandable, not a lot of scientific jargon, and I think really demonstrates that their sincerity toward this. And the do no harm has to do with, don't look at people that are asking questions or are hesitant as stupid, not informed, not understanding what's going on. No, we have to be very patient and understand their questions. I know when I was volunteering at the COVID clinic, I had a chance to talk with people and they had very valid questions like, you know, if my arm hurts or I get a fever, does that mean I have COVID? No, it means the vaccine is working. And some folks who were cancer survivors or people that were on immunotherapy had questions, is it safe for me to take this? And also we had women that were contemplating pregnancy or were pregnant or were breastfeeding. And again, to be able to reassure them that all the studies to date show that this is safe for them to take. So that kind of a listening approach, I think, is very important. And to take the idea that we're educating people and we're filling an information gap and we're changing the perception of risk. I think when the Johnson & Johnson vaccine got put on hold for 2 weeks because of a question of this blood clotting issue, that introduced a real question in terms of what is the risk to me? And we need to be able to intelligently talk about that. And again, not with the idea that we're lying to people or giving them false information, but really to give them a good idea of what I used to use in critical practice. What is the risk, the benefit, and the alternative to anything that we do? And so I think it's important to go ahead and build that trust and really the attitude of caring. And so, Mike, I want to applaud whomever is writing those those questions and answers. Seem to be doing a great job.
Yeah, I wish I could take all the credit, but I mean, I certainly, yeah. Well, I pushed our communications department to post them, but I certainly didn't come up with them myself. But they are good. I agree. Great,
thank you. The other article that caught my attention is about 2/3 of the way down of this cover, and it says e-cigarette use during the COVID-19. And I'm bringing this up because it's going to apply to something we're going to discuss in just a minute. But that was a study that was done last year. It was an online survey of youth and young adults, and it had to do with their use of tobacco products and vaping products. And the interesting thing, and this might be a benefit coming out of the pandemic, the vaping utilization actually diminished. Among high school students, the usage in 2019 was 27.5, and at the time of the survey, it was 19.5. And there were a number of reasons that that number may have gone down. One may have been that vaping in tobacco shops were considered non-essential. And so if you can't get your product, you can't smoke it. The other thing is that schools were closed. And something I learned from the article is that a lot of the vaping especially is peer pressure, is people getting together, sharing their vaping materials. And if you're not in school in person, you don't have that kind of peer pressure on you. There also were issues around kids could no longer work. They weren't getting an income. They couldn't afford to go and buy tobacco or vaping material. It was harder to find stores that were open. There was just reduced access to this. The other thing that was interesting, and again, this was relatively early in the pandemic, but there was no evidence of an increase in using combustible tobacco, in other words, smoking tobacco products. So the lessons to take away are that the retail environment is very important. The point of sale where these products can be purchased really kind of drives utilization. Any effort to reduce use probably would revolve around looking at that point of sale and having some sort of intervention there. Now, there are limitations with this. This all was self-reported online. It was for several months, not a full year. And it could be that the data will show going forward that use has increased or at least returned to 2019 levels. But I thought this was a really interesting article in terms of what might be effective in terms of controlling, especially vaping material. So I don't know if you have any questions. No. Okay. Well, that's the end of my report. Mike, you want to take it away? Mike, you're on mute now.
Sorry, I muted myself. So yeah, so I have my director's monthly report, and most of it's focused. I'm going to share my screen again. Most of it is focused on COVID at this point, although I will say that I would think that moving forward here, I can redirect some of my energy in these meetings towards presenting some of the other program areas that we're going to start working on more. For example, in July here, we plan on reopening up our immunization clinic for our other vaccines that we provide to the community, to the underserved, and also opening up our lending closet in Health and Human Services. And we're going to start meeting clients for benefit access and some of the other programs that we've been offering for years to Skokie residents. And what I wanted to do was to start providing information, not only updates on some of our accomplishments moving forward outside of COVID, but also talk about some of these wonderful programs we have, just to sort of give the Board of Health an idea of some of the things we do, because I think sometimes we tend to focus on, at least over the last year and a half, just on COVID. And I'd like to start introducing more of that to the meeting. So, but for tonight, it's mostly COVID related. So this is the agenda. I'll talk about data a little bit and our vaccine updates. And then of course, the big one is the Restore Illinois update that's effective tomorrow. And also I'll talk about a little bit of other Health and Human Services, although really most of what I want to talk about is COVID. So this is the updated numbers for Skokie through 6/9. As you can see, we're at about 6,000 total cases in Skokie. But the good news is that our current 7-day moving average is around 3.25 cases per day, which is really, it's remarkable, really, when you think about how we've gone from middle of November being at like 50 cases a day, almost 60 cases a day, to now at 3.25. We've seen a significant decrease, not only here in Skokie, but around the state. And our positivity rate is only at 0.89%, where Cook County's at 1.4. So it's, you know, if it's not the vaccine, then what is it, right? I mean, it's certainly truly amazing. So in Illinois, again, we continue to see this downward trend, and we have seen this trend for a while, but the last week or so, we've been seeing right around 350 maybe cases per day, which is pretty amazing. This is some Skokie data since around April 1st. We certainly don't see the same significant trend just because of we just don't collect as much data or have as much data. But you can certainly see that our daily case count is really diminishing rather quickly, which is a really good thing here at Skokie. This is the state of Illinois. This is sort of the broader chart where you can see that really the number of cases being reported is the lowest it's really been since the beginning of the pandemic. And, I think we can all agree that back in April or May of 2020, not nearly as many people were being tested. So the positivity rate back in April, May 2020 was significantly higher. And, that's just more good news as to, you look at the numbers. Well, so many more people were being tested now than before that the numbers being lower and or is equal to back in the late May, early May is really, again, a remarkable statistic. So this is just some information about the number of vaccine doses that we've administered here in Skokie based upon vaccine type. Moderna is the vaccine that we were receiving. It's the vaccine that we received from the state. So there was a long period of time there where we didn't have a choice. I mean, they were essentially saying this is the only vaccine that's available to the village of Skokie, and we've administered about 26,000 plus doses of that to date. We've administered about a little over 1,000 doses of Pfizer and about 128 doses of Johnson & Johnson. Now, anecdotally for all three, Johnson & Johnson, I'm fairly confident that the 2-week pause on administering Johnson & Johnson affected people's willingness to accept that vaccine, because we are primarily using Johnson & Johnson for homebound residents at this point. We did offer Johnson & Johnson. We had a Johnson & Johnson clinic scheduled probably within days of them pausing administration. Or no, I think it was actually planned for like a week or two in advance. And we had posted that clinic and we got a very lukewarm response. I mean, we could hardly get anyone to come to that clinic. And then just recently, when I say recently, within the last month, we started receiving Pfizer vaccine because it became more readily available. And we've primarily been administering that vaccine to persons under the age of 18. And that's sort of where you get that 1,149 doses. Now, the bottom chart provides in the second column, the Skokie data, and the furthest right column, the state of Illinois data on actual, the number of doses and percent of doses. Now, if you look at Skokie in total, there's been 44,347 first dose, or Skokie residents who have got at least the one dose, which is about 71%, which is great news because we're getting very close to that 75-80% herd immunity here in Skokie. I think that Dr. Warner had emailed me earlier today and related that, along with the 6,000 plus actual cases of COVID, it may be possible that if a significant percentage of those who had the disease didn't get the vaccine, that we may very well be above 75% at this point in Skokie. To be honest with you, I actually asked one of my nurses today to send me the actual raw data from Salesforce, is where we collect the actual case data. And I was going to run a report and reconcile it versus our immunization data from iCare, but I just didn't. I ran out of time this afternoon. In regards to the percent of residents over or equal to the age of 65 with one dose, 96% based on census have received the vaccine. And you guys can also compare it to the state of Illinois. You know, we're at 60% for one dose and 82% for people 65 and older. And then for 2 doses, we have 37,583 residents, which is 60%. And there's 44.5% for the state. So, you know, again, I'm going to give a huge amount of credit to just Skokie residents in general. I'm going to give a huge amount of credit to staff, and then I'm going to give a huge thank you again to all of the volunteers that helped. We couldn't have run these clinics, these larger clinics, without the help of the volunteers. I know many of you on the Board of Health had volunteered, and I can't thank you guys enough. This is a chart I put together this afternoon that provides, this is Skokie administration data based on date. What's interesting about this is the black bars are first doses and the red bars are second doses. And you sort of see this like cyclical thing where, for example, between the end of December and the beginning of February, we were administering for primary first doses. And then what we did is we kind of shifted to mostly administering second doses. Then we went back to first doses and then back to second doses. And then lately we've sort of been in between with first and second. But we have seen the demand for vaccine as of like the first week of May, or around the middle of May, just disappear. It's just amazing how we went from January, February, March, where we had so many phone calls in the village that we couldn't keep up. There were nights when the mailbox was full. We had like 10, 15 people answering calls. We had basically a phone center, and we had the library assisting us, and we had trustees assisting us with phones. To basically, you know, there's actually times when the phone's not ringing in Health and Human Services, it's kind of refreshing, actually. Other vaccine updates. So we continue to offer vaccine. I mean, anybody can go to the village website. It's open. Just go on our website and log in and register. Our clinics are currently primarily being held out at Village Hall. We've shifted away from our mass vaccination site at 770 Frontage Road. Our last second dose clinic is actually on June 16th, which is next week. And then we're going to take a break. So unless we do booster shots, or unless, you know, we need that space over there, we actually are considering administering flu shots over at the space because it's a wonderful space for vaccinating people. But for now, we'll be out of that space, and people will actually be physically coming into the Village Hall, coming into the basement, and we'll be administering doses there. And then the last thing I have to mention is that in addition to offering vaccine clinics a couple times a week in the Health and Human Services Department at Village Hall, we're also going to be out of Juneteenth on June 19th, which is a Saturday. I think it's between 4 and 6 p.m., I want to say, at the Devonshire Center. And we'll also be at the Skokie Farmers Market. And we're going to have students actually walking around those locations, and anybody who hasn't been vaccinated, they're going to, I tease the students that they're going to have to wear sandwich boards and walk around, but we're actually going to walk around and hand out pamphlets or just encourage people who haven't been vaccinated to walk in and get vaccinated. So we are offering some other night and weekend clinics. So we're trying to, you know, hopefully people take advantage of it. It's free, and it's something that we certainly want people to get. Restore Illinois. So as you all know by now, the state is moving to phase 5 of Restore Illinois. I quite honestly, a year ago or even back in January of 2020, I could have never imagined us actually finally getting here. It's really, truly amazing that the data supports this. And hopefully the data will continue to support the state being open like this. But essentially what the state says is that for indoor businesses and venues, unvaccinated persons should, I should have underlined and bolded that, but should continue to wear face coverings and socially distance. It doesn't say must. Outdoor businesses and venues, unvaccinated persons may choose not to wear a face mask. when they can't socially distance. And in general, vaccinated persons, except for certain congregate settings, such as public transportation, long-term care facilities, schools, and in healthcare settings, don't have to wear it. So in those settings, they do. But otherwise, you don't. Now, another caveat is that businesses and venues can choose to be more restrictive. So if you go to a store and it says you must wear a mask, that's their decision, and you have to abide by it according to the governor's office. So with that said, that's what I have to present in regards to COVID. Other updates in the health department. Couple interesting tidbits besides opening up the, like I said, in July, we're going to start providing some of the other vaccines to the public. And we primarily vaccine individuals who don't have insurance or otherwise underinsured or below the poverty level. We continue to conduct the childhood-led program. Health and Human Services recently, in the month of March, had we created this co-responder program, and we did a pilot where our human services social workers and the social worker from the police department went out to every police call that involves anything that involved like a mental behavioral health crisis. So we're testing to see whether or not that's going to increase our linkage to social services, and also decrease recidivism with some of the individuals that we see more often, and see if we can have actually a social worker on scene at the time when there's a crisis, to see how that can improve the relationship between even the police department and those individuals. And like I said, link them to appropriate services. So we're going to be sitting down and sort of evaluating how well that worked with some data that we've collected, and then decide what the next steps are soon with that program. But it seems like a really promising program. It's just there's certain barriers to keeping it long term, but certainly something we're going to adjust and look at moving forward. So with that said, I certainly can answer any questions anyone has, or if there's any discussion.
Thanks, Mike.
If not, I'll pass it back to you.
Thanks. I have a question for Dr. Vernon. Dr. Vernon, there's been some reports of the Delta variants now circulating in Chicago and Illinois. Do you know if that's very prevalent right now? And any idea in terms of the effectiveness of the vaccines against the Delta variant?
Yes, Dr. Warner, I can confirm that we have identified the Delta variant in Illinois and in the Chicago area. I'm not sure exactly how prevalent it is, but just as we were concerned about the Alpha variant, which is the B.1.1.7, which eventually became the dominant strain in the United States, I think we ought to be concerned about this Delta variant and the circulation in the United States. We've seen it become pretty much the dominant strain now in the UK, and that is something that we should try to avoid at all costs. That's why even with us moving into phase 5, adherence to the guidance that Mike just went through from the state in terms of unvaccinated persons continuing to engage in those preventive measures, I think will be key.
I have two questions. One, I was talking to a patient who was vaccinated about in the spring. She works for a ballpark, and she was told that she had booster vaccine scheduled 6 months from the last shot. I have not heard it from anywhere, but she told me that she had an appointment for booster in October. Second question is, do we have any data on these? I know our positivity rate is less than 1%, whether these patients have gotten vaccines or not. Do we have that data?
As far as the first point, I haven't seen anything that has recommended or approved a booster shot. So I'm not quite sure where that is coming from. But does anybody else have any information about that?
No,
I haven't heard anything from the state.
there's been no mention of, there's the potential that we may need a booster, but there's been no definitive statement from the CDC or the FDA regarding when that might be necessary.
And Dr. Shim, your second question was?
Whether any of the new positivity cases of COVID, whether we have a history of whether these individuals were vaccinated or not, because it sounds like the dominant type of COVID now is the mutant, so it seems like the vaccines are effective. I'm wondering, if any of the new positive patients have had, double 2 shots vaccines and they still got infected or not.
So I can confirm that we have had residents that were fully vaccinated that did test positive. I don't have data to support how many or what percent, but I can take, actually I was going to do this. I know this sounds like I'm not lying about this either. I asked for the aggregate data at about 2:00 from one of the nurses on all our positive cases, and I was going to cross-reference it by last and first name and date of birth versus the iCare database, which is the vaccine database, and then try to figure out how many people that were fully vaccinated. But I don't have the data at this second. But maybe what I can do is when I do run the data within the next couple of business days, maybe I'll share something with the Board of Health. But if I did, there can be no discussion. That's all. I could provide it as just like a heads up, but you just got to be careful with like, hey, that looks interesting, and start like an email discussion, because it'll be a violation of the Open Meetings Act.
Yeah. Are those patients just testing positive, or are they symptomatic? Do they need to be hospitalized?
Yeah, anecdotally, I don't know the answer to that question. Whether, that's something that's a little deeper than what I'm aware of at this point. But yeah, I think probably all of the above. I think there's been, I know for a fact we've had at least one person that was fully vaccinated, that person also had a lot of underlying health conditions. But anecdotally,
Mike?
That's the only one I'm really aware of.
Mike,
Yes.
this is Edlin. I can speak to the greater Cook County and Chicagoland area. And clearly there are vaccinated people that have tested positive for COVID, especially in nursing homes and congregate living areas. But I was told that the vast majority of them do not have significant illness. But there have been cases that have been hospitalized with confirmed vaccination. So it just points out the fact that many people will exhibit a variable response to the vaccine immunologically. And that's why I think we have to still be cautious about, being around people that aren't vaccinated who may be carrying the infection.
Yeah, from what I've read, people who are vaccinated and then become positive with COVID do not have the same degree of severity in terms of severe illness, hospitalizations, and death. I don't have numbers for that, but that's something that I've read about.
Yeah, that is the case everywhere. And but I do know some people that have been of cases where they've been hospitalized. I don't know them personally, but I know the treating physicians. We've been discussing this at our COVID task force for the Chicago Medical Society, and but it's still unusual. And far and away, these are very effective vaccines.
Yeah, and Dr. Shim asked a very important question. Is it failure to get vaccinated, or is it vaccine failure? And I think the statistics that Mike Charlie is referring to will help us clarify that. Who's getting ill? Have they been vaccinated, or have they not been vaccinated? And I haven't seen any real studies coming out with that kind of information, that kind of data.
Yeah, and I did run, so back about, I would say maybe a month and a half, 2 months ago, I did run a report. And so we had, at that time, we had 1,000 COVID cases since the beginning of January. And out of those 1,000 cases, 6 were fully vaccinated. 994 were not fully vaccinated. And I don't, that was a month or two ago, so this data can be a little bit different right now, but an overwhelming majority of our cases were people who were not yet fully vaccinated at that time.
This is Mike Vernon. I just wanted to comment that we do see a lot of, they refer to these cases as vaccine breakthrough cases, whereby you're fully vaccinated, but you still test positive for the virus. Initially, we were reporting or required to report, local health departments were required to report all of these cases to the state, but the numbers became so overwhelming, and CDC endorses this as well, that the only reported cases now are the ones that are hospitalized. Those are the ones that they're focusing their attention on. And those are very few, I must say.
Thanks for clarifying that. Mike, any other comments? No. On the agenda, we have 2 items under old and new business. The first is banning of e-cigarette vaping products ordinance update. At our last meeting, we passed a resolution about banning the sale of flavored tobacco products and flavored e-cigarette products. That was put into a structured form that Director Charlie then brought to the village administration. And Mike, do you want to give us an update where that stands now?
Yeah, absolutely, Dr. Warner. So yeah, so I submitted a memo to the village manager, and he then submitted the information to the village board. And one of the questions that came up was, whether or not it was appropriate at this time to pursue prohibiting the sale of the flavored vaping and or the flavored like leafy tobacco products. And I think at least internally, between the village manager and I and some staff, to date, they're really, and I think I don't know if I misspoke the last time we met, but even in Oak Park, we only banned the vaping products. There really hasn't been no municipality that's actually banned leafy tobacco flavored tobacco products. So at least my recommendation as a staff member would be for us to initially pursue, maybe not recommending, but at least supporting the village board prohibiting the sale of flavored vaping products, sort of as a first step. And after I did submit it to the village manager, he had submitted something to the village board, and he had asked that we give the village board a little time to digest this. And he requested, and I agreed, that Dr. Warner and I would present to the board on July 19th, I believe. That's the second meeting of July, just to give the village board some time to digest it and understand what the recommendation is before we actually present. So I don't know if that summed it up, Dr. Warner, or not. If you have anything else to add.
I just want to add that one article that I discussed from the American Public Health Journal really talked about the point of sale being quite important in terms of controlling the vaping products. And so I think that would lend some credibility to taking this approach. But, we did talk about this at the last meeting, and this is a change from that resolution that passed. So is there discussion?
Is there still certainly, is it, I don't know how to ask this question, but it sounds to me like the Board of Health is supportive of Dr. Warner and I presenting to the board, a strong recommendation on prohibiting the sale of flavored vaping products. And then I certainly think we can put a spin on the end saying, look, inevitably, maybe we won't be the first municipality, but inevitably, I think we have to be prepared for the eventuality that prohibiting the sale of flavored other leafy tobacco products may also be a good public health step to prevent at least the younger population from starting on those products also. So, I mean, if everybody in the Board of Health is supportive of that direction, I don't know if we necessarily need a resolution, but is anyone opposed to it? Like strongly opposed to that? I'm looking around, everyone seems I got one thumbs up. Someone knows how to use Zoom.
Yeah, I've
Got
seen
another
it.
thumbs up, okay. Okay, good.
All right.
Well, thank you guys. Thanks everyone for your patience and your feedback on that.
Thank you all. The other is I thought this was a great idea, proclamation thanking Erie Crown Hebrew Day School and the Medical Reserve Corps volunteers. And Mike, again, do you want to fill us out on that?
Yeah, I would love for first of all, since we don't meet in July and we don't meet in August and the proclamation isn't written yet, what I'd love to do is I would love to work with Dr. Warner and draft a proclamation thanking the Erie Crown Hebrew Day School for allowing us to use their giant, wonderful space for free, by the way, for all of those clinics. And I'd love to thank the Medical Reserve Corps volunteers, the library volunteers, the Park District volunteers, the nursing students that we used at the clinic. I mean, they were just amazing. But I would love to do something. And, I think that this proclamation that would be drafted by Dr. Warner, certainly with my input, would then be submitted to the village board. And I think we've also discussed, at least internally, at some point here, we're going to provide some sort of tribute to them in regards to having a separate event for those individuals, and whether it be, non-alcoholic beverages and hors d'oeuvres or what we haven't decided yet. But certainly I think that proclamation, if we submitted it to the board, they read it and we had it prepared for that celebration with those individuals. I guess maybe we were looking for, Dr. Warner, you can correct me if I'm wrong, is just, the Board of Health's thumbs up and concurrence that that's something that's not, maybe not needed, but a nice thing to do.
Yeah, no, I agree. And one thing I suggested to Mike is, could we get the cumulative hours of volunteer work that went into this? I think that would be impressive, because I know, Pat, you were there, Ed, you were there. We had how many clinics? At least a couple dozen. Some for 4, 5, 6 hours, and a lot of volunteer work. Like Mike said, it couldn't have been done without the facility and without the volunteers.
Absolutely. I can't. I mean, every time I see the Kenny Landsman, he's our contact at even Erie Crown. I almost want to hug him. I know we're not supposed to hug or shake hands, or we're getting closer, but it's just amazing how gracious people were with their time. I mean, every time I went over there, I saw Dr. Lynn drawing vials of vaccine, and never complained or never was just super friendly, and and it was so helpful to have everyone there. So I thank you to everyone who's volunteered.
Well, it's a great idea.
I also had another suggestion. If we could also do kind of some shout out, or in the new Skokie as well, for all the volunteers, because I agree they did such an incredible job with all the clinics.
Absolutely.
And Pat is also recognizing the great staff in the department. Well, it was interesting when we would get started. Sue Riesberg would lead everybody in it's showtime. That really was sort of an esprit de corps for the folks that were volunteering there. And I think everybody was really happy to serve and really proud that they were able to do that service.
Mhm. And I can speak on behalf of staff that since January, I've been doing this a long time in public health. I've been doing this for like 20 some years. And there was always, in the past 20 some years, there was always like moments in time where you could sit back at your desk and be creative and take a deep breath and work, just focus on things like budget and programs. And this last year and a half has been everything's moved so fast that really it's been a kind of weird over the last week or two, where I've been able to like refocus my energy on like vision and hearing and co-responder program and the homeless. I was out walking along the canal this week to talk about how we're managing or helping the homeless, and just all these things that I haven't worked on in a year and a half. It's just amazing. It's just great to be able to do other things besides focus 100% on COVID all the time. So, I'm so thankful for the vaccine. I'm thankful that, again, we had all these individuals assist us with the campaign, and certainly appreciate everything.
So I'll ask, is there any objection to developing the proclamation? Seeing none, then
Okay.
Mike and I will work on that. Can we, since we're not going to meet until September, should we distribute that to the board when it's in draft form for input?
Well, the problem is that we're not supposed to solicit input under the Open Meetings Act.
Okay.
I guess what we could do is we probably could provide under the Open Meeting Act, the resolution, and then people just email me directly. Okay. If they have any input into the proclamation. And then what I can do is I can consolidate all the recommendations and input into the document, and then just Bill and I can work on it, finalize it, if that's okay with everyone.
Yeah, we don't want to get you in trouble. I don't know what the penalties are for violating the Open Meetings Act, but we don't want to find out.
No.
All right. Well, we're at the end of the agenda. Are there any public comments, Mike?
There were no public comments, no.
Okay. And our next meeting is not going to be until the second Thursday in September. We're not going to meet during July and August. Now, in the past, we've gone for a group dinner in August. I don't know if that's realistic for this year. This may be one of those things, again, when we come out of this, we'll have a better idea. With that, and any idea when we might be able to meet in person again? Is that, no, that's
soon, I hope.
I hope so. I hope by September.
I think by September, I think it's a very good possibility, unless the data trends in the wrong direction.
Okay. And that is an important point, because we're coming up on 2 weeks now from Memorial Weekend, when there were a lot of barbecues and get-togethers and so on. And I think we need to be very cognizant that if there's a spike after that, it's going to be concerning. Dr. Vernon, I don't know if you've seen anything trending that way so far in the data. It's probably a little too early to tell that.
Yes, it is. We're very watchful, particularly going into phase 5 with everything reopening. And, one of the major things that will be put into effect in phase 5 is there are no capacity limits in terms of meetings or gatherings. So we're very watchful and concerned about this, particularly when we're not able to adequately distinguish between who's vaccinated and who's not.
Thank you. Well, we're at the end of the agenda. Any other business for the board? Seeing none, then is there a motion to adjourn? Pat made a motion. All in favor, raise your hands. All right, we're adjourned. Thank you very much. Have a good summer. See you in September.
Okay, thank you. Thank you.
Bye, guys. Thank you.
Bye.
Everyone stay healthy.